Welcome. Today we'll be talking about using bidirectional text messaging to engage patients in chronic disease management. My name is Amy Czar, and I am the Associate Director of Population Health for the Michigan Primary Care Association. I work with FQHCS across the state to help them optimize their utilization of health IT tools and platforms to improve patient health outcomes and meet value-based performance targets. MPCA has integrated Azara drives with the Luma Health Patient Outreach and Engagement Platform for bidirectional patient text communication that 24 of our 40 FQHCs subscribe to. I have a background in clinical quality improvement, working in community health settings for the past 8 years.
Hi, I'm Dr. Tracy Angelosi. I'm the Chief Medical Officer at CareMessage. CareMessage is the largest patient activation platform built exclusively for federally qualified health centers and free and charitable clinics, and is used by more than 400 safety net healthcare organizations. I'm an internist and pediatrician, and before joining CareMessage last year, I served for 11 years as the Chief Medical Information Officer at a large FQHC in Central Texas. We know that effective management of chronic conditions requires many touch points beyond visits with a primary care provider. The average American has 4 PCP visits and well under 2 hours of face time with their healthcare provider annually. So more time is needed for education and to build confidence in disease self-management skills. There is an increasing movement towards omni-channel engagement in healthcare and away from offering a call center as the only form of communication accessible by the patient. But as digital health interventions and increasing technology make their way into our practices, community health centers need to be aware of the digital divide. Mobile apps and patient portals, both of which require broadband access or data plans, as well as some degree of technical literacy, will leave a segment of our patients behind. But this is where SMS texting can become a great equalizer. The latest Pew research shows that 97% of Americans now own a cell phone. Smartphone ownership has risen to 85% and is now equivalent across racial and ethnic groups. But that does mean that 15% of the general population, and likely a much higher percentage in FQHC patients, can interact with us only by SMS texting and cannot use mobile apps. And the importance of texting becomes more critical with those over age 65, as nearly 40% do not own a smartphone. And we see a similar dependence on texting in those at lower income and education levels. There is a growing body of evidence that texting can be effective in driving healthy behavior. I'm sure you're all familiar with the USPSTF, the Preventive Services Task Force, that independently reviews evidence for clinical preventive services and develops recommendations. But you might not be aware that there is a related Community Preventive Services Task Force. This is an independent panel established by DHHS more than 25 years ago, and it reviews the evidence on community-based health promotion and disease prevention approaches. The task force publishes their findings and recommendations in an online forum called the Community Guide, and the available evidence on texting shows that it is a helpful intervention in some specific situations that have been studied by the CPSTF. That is, medication adherence in chronic conditions, smoking cessation interventions, and reminders for cancer screenings. At CareMessage, we're building our own body of evidence for texting by conducting randomized controlled trials with university and FQHC partners. I've included a link to those studies, but I'll just quickly highlight one here. We studied the effectiveness of a 12-week diabetes text messaging program with low-income Latino patients at 2 FQHC centers in Los Angeles. The diabetes text program is bidirectional, sprinkled with questions throughout, and then branching logic incorporates patient responses to those questions to further personalize the education program for each patient. In the end, the intervention group had an average HbA1c reduction of 0.4 percentage points compared to the control group. But the subset of patients that were more highly engaged in the text program, who responded to more of the question prompts, experienced a significant mean reduction in A1C of 2.2 points.
As we just heard, there is mounting evidence that text messages are an effective means of communicating with patients to manage chronic conditions, particularly those most vulnerable to poor health outcomes. Directly engaging with patients one-on-one provides more personalized care and support to patients, while sending messages en masse as one-to-many or broadcast messages with educational information, community resources, and screenings and assessments saves staff time. Depending on the system used, there are types of communication that can be sent through an automation process, including broadcast messages, appointment reminders, and medication adherence and refill reminders. This allows for more focused time on one-on-one communication with higher risk, higher need patients with chronic conditions. When texting patients to help them better manage their chronic conditions, it is important to take into consideration many factors that can either enhance or detract from the effectiveness of the message. Respecting patient preferences and sending personalized text messages they will understand in their native language and account for different learning modalities can ultimately lead to positive interactions with patients. They will more likely respond to messages you send because it signals to them that my care team wants to see me improve my health status. Patients will then be more receptive to future messages you send, collaborate on goals to achieve better health, and become champions of their own health. However, one must be cautious as to not bombard patients with messages. Being strategic and following an outreach calendar of types of messages to send will reduce the likelihood that patients will ignore or opt out of receiving messages in the future. It is also strongly advisable not to use nagging or fear tactics when encouraging patients to make behavior changes that lead to improved health outcomes. Rather, meeting patients where they're at in the stages of behavior change and using techniques such as motivational interviewing to guide patients to taking steps that will improve their chronic conditions when they're ready will be more effective.
Amy touched on the importance of understanding the theories of behavior change and incorporating that into your messaging. And that's a topic we could devote an entire webinar to, but I'll just give a quick overview here. Multiple theories, I've listed a few here, have been extensively studied in healthcare, and evidence shows that a person's readiness to engage in health-related behavior is determined by their perception of a handful of common variables that we see across the models. The first is perceived susceptibility. That is, me as the patient, do I believe I'm actually at risk of getting the condition or the complication that you're messaging me about? It's important here to know that people tend to underestimate their risk for disease as compared to others, a phenomenon known as optimistic bias. The second is perceived severity. If I believe I'm at risk, how serious do I think the consequences are? The first two together are sometimes referred to as the threat analysis. I need to believe both that I'm at risk and that the consequences are serious in order to motivate me to take action. The third is perceived benefit, sometimes called response efficacy. That is, do I believe the action you want me to take is actually beneficial and will reduce my risk? And the fourth factor is all about barriers. These can be real or structural, like transportation or cost barriers, or they can be perceived or internal and refer to things like discomfort, embarrassment, the time, cost, or the hassle factor of completing the action. Some theories include the factor of self-efficacy. That refers to the patient's belief in whether they can follow through on the recommended action and overcome the barriers. And others point to the influence of subjective norms. This refers to a patient's belief about whether most people approve or disapprove of the behavior. I'm more likely to follow through on the suggested action if my peers or people of importance to me think that I should engage in the behavior. And then finally, cues to action are important. The more prompts or nudges I receive, the more I pay attention and begin considering the action. In our case, we're talking about text messages as that cue, but this can be any sort of outreach through any communication medium, including mass media. So the best practice in text messaging is to be aware of these factors and incorporate them into your campaigns. This points towards a strategy of using a series of related text messages about a given topic, as there is obviously no way to incorporate all of these factors into a single message. Even if you choose not to address each factor, remember that the simple reminder text that is used most often, that is the "you're due for this thing, call us to schedule," is really only going to be effective for a small segment of your population. It will only prompt those who already believe the threat is real, believe the proposed action is effective, and who are not facing any significant barriers.
When texting with patients, taking a team-based care approach with various clinical and non-clinical support staff and integrating them into patient communication workflows allows for better managed patient outcomes. For example, community health workers can use texting platforms to send one-to-many or care gap broadcast messages requesting patients schedule an appointment with their provider. Some population health outreach platforms have self-directed patient scheduling features that allow patients to easily pick a time that's convenient for them without even having to call the clinic back. As noted in a previous slide, it is important not to bombard patients with too many messages. Otherwise, they could ignore or opt out of the text altogether. Instead, focus on 1 to 2 care gap messages per month and send to patients without upcoming appointments if no other actions are needed on the patient's part to prepare for their visit. Another example of using staff available to you is incorporating nurse care managers into patient engagement workflows for monthly or bi-monthly direct texting to provide educational and/or community resources they may need to better manage their chronic conditions. Automation is key. The more use cases you can automate, the more free time staff will have to provide more direct support to the patients who need it the most. It can be difficult to determine a cause and effect relationship between patients receiving text messages and improvement in clinical outcomes due to reporting limitations, but certain inferences can be made. An improvement in chronic condition and chronic disease quality measures month over month from the time texting campaigns began can be attributed to its effectiveness. However, it may take several months or more before you start to see any improvement in some clinical measures, but you can also look to process measures such as reduced no-show rates and increased number of office visits as indicators that text messaging is effective. Some texting platforms are more sophisticated than others. For example, if you are using Azara Patient Outreach, reporting on the effectiveness of the messages is part of the add-on feature. We hope this pre-work session has been informative and provided actionable steps you can take to provide bi-directional communication with your patients to better manage their chronic conditions. We look forward to seeing you during NAC's live session, March 15th, where we will answer any questions you have and elaborate on the content presented in this video.